All right. Welcome, everyone. Let me share my screen. Welcome. We'll let folks join. You are in the Somerville Climate Forward Ambassadors webinar about climate resilience and health. So we're just going to get started in a minute or two as people join. We've got a lot to cover tonight, so I'm going to get going quickly. All right, welcome everyone. My name is Hannah Payne. I'm the Climate Change Program Manager with the City of Somerville. You are all here for the Climate Forward Ambassadors webinar, our last one in this series. And tonight we're talking about climate resilience and health. We've got a really great lineup of speakers, so I want to jump right into it. I do just want to note that we are recording this session, so please be aware of that, and we'll be posting it on the city's YouTube page after the fact. So our agenda for this evening is I'm going to give you a very, very quick review of the climate impacts in Somerville and what's in our climate action plan. Then I'm going to turn things over to Jeanette Pantoja, who is a public health planner at the Metropolitan Area Planning Council, which is our regional planning agency for the Boston area. She's going to talk about health and climate change and those connections there. And then we have two folks from our engineering department with the city, Luchika Hiller and Jonathan Smith, who will be talking about stormwater management and what the city's doing on managing stormwater and flooding in the city. And then we'll have time for Q&A at the end. So as you're listening to the presentations, please type your questions into the Q&A box or the chat, and we will get to as many as we can at the end of the presentations. Okay, so for those of you who have been to these webinars before, this will look familiar to you. In 2017, our office, the Office of Sustainability and Environment, completed a climate change vulnerability assessment that looked at how will Somerville be impacted by climate change. So we've looked at downscaled climate projections to really understand how will climate change affect Somerville. And there are three main things we focused on in this study. First is heat. Second is precipitation. So we're going to be experiencing larger, more intense rainstorms, so that drop more water. And then the third is coastal flooding. So from larger coastal storms coupled with sea level rise, we could see flooding coming up through the Mystic River in Boston Harbor. So those are the three impacts that we are really planning for in Somerville. And this, the climate change vulnerability assessment was a key baseline study that informed our climate action plan, Somerville Climate Forward. And so this is just a quick reminder of all of the things that the plan covers, and we'll touch on a number of these tonight that are connected to climate resilience and really preparing for those impacts. So things like building a healthy and resilient community, managing stormwater, but really all of our climate strategies need to have an element of preparing for this new climate that we will all be living in. So that is the very quick overview I wanted to give, just to remind you of all of that we, kind of the larger context of planning that we have here. And I now want to pass it over to Jeanette, who's going to give you a much more in-depth discussion about health and climate change. So I'm going to stop sharing my screen, and then Jeanette, I think you should be able to share your screen and introduce yourself.
Great. Hi, everybody. So again, my name is Jeanette Pantoja. I'm a public health planner at the Metropolitan Area Planning Council. I'm just going back to the beginning here. And I was actually one of the first climate ambassadors. So I participated in the first cohort of the program. So again, I'm going to be talking about climate and health, a little bit about MAPC. So the Metropolitan Area Planning Council is the regional planning agency for the 101 cities and towns that make up Greater Boston, so the Boston metro region. And we work with these municipalities, local governments, and community groups within each of the communities to build a healthier, more vibrant, and resilient region. Some things that we'll cover in the next few minutes. So I'm hoping we can develop our familiarity with some of the terms and indicators of social vulnerability. So what do we say when communities are vulnerable to climate change? Increasing our knowledge of the health impacts of climate change and exploring how our collective actions might influence climate health outcomes. So I can't actually see the chat, but I'm gonna introduce just this exercise, and I invite you to kind of just think through it a little bit as I cover. So this is Alma, and I invite you to think, what factors make Alma more or less vulnerable to the impacts of climate change? How so? So a little bit about her. Alma is a mother of 3 young kids. She and her partner both work in construction. They make enough money to have some savings and own their own home. Alma has high blood pressure, but she has access to good health care and medication. So I'll just count to 10 while you all think through that, maybe add some things in the chat. Okay, I'm gonna move on. So here are some that you might have thought about, might have added in the chat. So factors that might make Alma more or less vulnerable to climate change. So less vulnerable, right? She owns her own home, she has savings. So we can assume that she has some financial resources to address any sort of impacts or potential vulnerabilities that she might have. She has good access to healthcare, which is critically important in terms of seeking treatment for potential climate and health impacts. But she also works outside, so she might be more exposed to heat, more exposed to mold on a work site related to extreme precipitation. And she has health conditions and takes medications that might increase her risk of heat stroke. So I'll say a little bit more about that specifically later. So just a definition, climate vulnerability. So climate vulnerability is the propensity or predisposition to be adversely affected by the impacts of climate change. Why do we care? Because climate change impacts some people more severely than others. And any efforts that we make to mitigate the impacts of climate change, mitigate climate change itself, and build resilience need to prioritize communities that are most impacted. So solutions to tackle vulnerabilities at the root, those most impacted also need to be active leaders and participants in kind of any sort of resiliency efforts. There are 3 dimensions of vulnerability that we typically talk about as public health practitioners and climate planners. So there's exposure. So how close is a community to a weather-related hazard? Do you live in a heat island? Do you live along the coastline? Sensitivity, so the pre-existing social, economic, and physical conditions of an individual or a community that influence their propensity to be impacted. So someone who is much younger or much older has existing health conditions, for example, And then capacity to adapt is just the ability to get out of harm's way, either because you have the resources, or there are personally, or there are resources provided through your community. We have a tool on the MAPC website. So it's you can Google the MAPC Climate Vulnerability Analysis and it'll come up, and it includes some interactive maps, indicators, and background on those indicators. So you can see how different areas of the region kind of compare to each other. And this tool was developed by looking at data that comes behind each of those kind of dimensions of vulnerability. So exposure, sensitivity, I already mentioned some of those. So there's age, there's pre-existing health conditions, there are kind of your living environment. So do you live in overcrowded housing? And then adaptive capacity, really about kind of resources, both financial and informational. And I think it's really important to think, especially in this moment, that many of the same socioeconomic conditions that contributed to disparities in who got COVID and also increased vulnerability to climate change. I just want to emphasize one really important point is that, people are never the problem, systems are the problem. I've definitely worked in communities where, you ask them, what are some of your vulnerability? And they might say, oh, we have a large population of non-English speaking residents. That is not a vulnerability. That is not inherently a vulnerability. The challenge might instead be that, the city or town does not have the capacity to work with community members whose primary language is not English. And so, have loved being a resident of Somerville and working closely with the city of Somerville. Somerviva is a really important resource that contributes to the resilience of the city and its community. So I'm just going to give a pretty quick survey of what are some of the health impacts of climate change. I'm certainly not going to cover everything. And we don't know a whole lot, to be quite honest, at this point. So really important point I want to make is that we have a lot more to learn about the connections between health and climate change. Health impacts of climate change has not largely been a research priority at the national level. I have here that only 5% of all US climate resilience investments went to the healthcare sector in 2016. Very recently, Scientific American put out this call saying we need a National Institute of Climate Change and Health, because the NIH spends what is really a paltry amount in terms of understanding what impacts of climate change, what are some of the interventions that will be most effective to address some of those health impacts, how do you diagnose issues related to climate and health. So I'm gonna share with you like what we know so far. Right, so climate change impacts in several different ways: heat illnesses, respiratory conditions, infectious diseases, consequences of extreme weather, mental health are kind of some of these broad categories. Extreme heat is an issue we've been doing a lot of work on in the last year with Somerville. So extreme heat interferes with our body's ability to cool down, and that causes a range of symptoms. So most familiar we might be with heat-related illnesses, so heat cramps, heat exhaustion, and stroke, but also prolonged exposure to heat over a season, over a heat wave, so a series of 3 days of consistent exposure to heat can worsen many chronic health conditions, mental health disorders, maternal health outcomes. So heat has been associated with preterm births and low birth weights and our ability to learn and cognitive function. So people without air conditioning are outdoor workers, isolated, most vulnerable, and also Many common conditions, especially for mental health conditions or heart conditions, can interfere with our ability to cope with hot weather. Heat is the #1 killer of any other kind of weather-related disaster. Well, with warmer weather, and some people might already be experiencing this, but the year's plants are putting out more pollen. The allergy season is getting longer and more severe. So people might be experiencing new allergy symptoms that they didn't have before, or more severe allergy symptoms. Warmer temperatures also increase ground level ozone, which can worsen air pollution. And that can make certain respiratory conditions worse, such as asthma, COPD, bronchitis, and emphysema. Children especially are at risk of suffering longer term conditions. And diseases transmitted through the bites of insects, so ticks, mosquitoes are becoming more common, partly because they're, the warmer season is longer, so they have a longer breeding season. We have more standing water from increased precipitation. They're expanding their geographic ranges. I think we had a fairly mild winter this year, and if we have, a wet spring, we could probably anticipate that we're going to have a lot of ticks and mosquitoes, a particularly severe season. So ticks transmit Lyme disease, which used to be more difficult to diagnose. Physicians will diagnose it much more readily now. If people can remember back to 2019, that summer, we were all really concerned about triple E in Massachusetts. Also experience water quality impacts, including Vibrio and cyanobacteria, so toxic algae. And many communities have also been reporting more problems with rodents as warmer winters result in fewer pup deaths. Climate change can cause trauma and worsen existing mental health conditions. This is especially associated with extreme storm events. So really saw really high rates of PTSD and other acute mental health conditions following events like Superstorm Sandy or Katrina. Victims of weather-related disasters are increased risk of also depression, anxiety, and suicide. Extreme weather events like heat waves are also associated with increased aggressive behavior, and can be also associated with displacement and loss of access to mental health services. And as I said before, some medications might interfere with our ability to cool down. What are some actions that we are taking at MAPC that are being taken by some local governments and community groups? I'll just cover kind of the relevance to our work and just to kind of start everyone's thinking on this topic. So what is climate resilience when we're using it? So climate resilience is the ability of community to address the needs of its built, social, and natural environment in order to anticipate, cope with, and rebound stronger from events related to climate change hazards. There are some core elements of climate resilience that frequently pop up in the literature, such as health, local knowledge, really, really important, but often hard to identify, like what are the evidence-based methods to increase this, or like our community networks and our social relationships. Resources in a community, preparedness, economic investment. Some things that I have been working on very closely with kind of our clean energy department at MAPC, and have learned some of this also through Hannah, are the connections between energy efficiency, climate, and health outcomes. So we know from the research that energy efficiency improves air quality, indoor temperatures, and can lower energy cost burdens for residents. There's still not a lot of research looking at energy efficiency and extreme climate-driven extreme heat and what some of the benefits might be of that. But we can kind of extrapolate from what we know in terms of the benefits related in the winter and the benefits of air conditioning. Health outcomes of energy efficiency have been most significant in programs that target homes of children with asthma. So asthma home visiting programs, partnering with energy efficiency programs could be a really powerful intervention. And then partnering energy efficiency with other types of healthy housing improvements, such as mold and lead remediation, has also demonstrated really strong health outcomes. This is something that we have been paying a lot of attention to, especially in the last year, and considering the connections between poor air quality and increased risk of not only contracting, but having kind of worse symptoms related to COVID-19 is the proximity of housing to highways. So housing near highways is associated with residential exposure to toxic air. One of my colleagues, Sharon, who's also a Somerville resident, has been doing more work on this and knows much more about it than I do. So Greater Boston residents of color are more likely to live near highways, and more communities, unfortunately, are zoning residential developments on the edge of towns rather than town centers, which we would prefer, often on former industrial sites near highways. So interventions are necessary across zoning, urban design, and transportation planning to reduce those air quality related risks. I'm not going to talk much about this because there's a team following me that's going to talk about stormwater, but have heard some reluctance in some communities around stormwater improvements and green infrastructure because of mosquito issues, but the opposite is actually true. So green infrastructure can reduce areas of standing water, and mosquito control practices such as aerial spraying might have trade-offs that we want to avoid. And this is work that we are actively doing with the city of Somerville, and could talk maybe a little bit more about it in the Q&A. So Keep Cool Somerville. It's an initiative to prepare Somerville for increasingly hotter summers. And so last year we engaged with residents and conducted some research. This photo is actually provided from a resident who participated in the Photo Voice project to learn how extreme heat affects Somerville residents. And this year we're funding mini grant opportunities for projects that are led by residents and community groups to address heat impacts this summer. So just, I'm going to end here. A few last things to understand. So health inequities and climate change share many of the same root causes and upstream drivers, and addressing climate change and health inequities will require transformational change in our communities. Planning decisions that we make as communities can be a driver for that change. So I'm just gonna stop sharing and turn it back to Hannah.
Thanks. Thanks, Jeanette. That was great. I'm just
You're muted, Hannah.
Thank you. I clicked like 3 times. Clearly it was the wrong number. So thank you, Jeanette. That was a really great presentation. I put the link in the chat to the Keep Cool project and our mini grant opportunity. So just want to plug that. And we have a meeting next Tuesday, or this upcoming Tuesday. If you have ideas, want to talk more about that, please join us. And now I want to turn it over to Luchika and Jonathan from our engineering department in the city. So Jeanette gave a really good overview for why it's so important for us to think about how do we prepare for the impacts of climate change and how it affects people. And now I want to zoom in to what does it look like to actually try to mitigate those risks of climate change, kind of specifically around increased stormwater and flooding in the city. So I will hand it over to them. So you should be able to share your screen. Let me know. Awesome.
Okay, can you see the presentation materials?
Yeah, looks great.
Okay, great. So hello everyone, I'm Jonathan Smith. I am a project manager in the engineering division.
Hi, I'm Luchika Hiller. I'm the Stormwater Program Manager in the Engineering Division. And I want to thank Hannah and the group for inviting us over to talk to you about the work our Engineering Division has been doing for the past few years. And you're going to see our presentation having this theme of what has been done in the past, what we're looking at now, and also what the future holds for the city. So I'm going to hand it over to Jonathan to talk about the past.
Thanks, Luchika. So how was our infrastructure built? It's very important to understand where we've come from to understand our present condition and what is possible in the future. So this diagram really illustrates how a lot of the development happened in Somerville. As you can see, the vast majority of the pipes that were put in the ground were done so before 1940. And that's important to understand because in a lot of situations, they were not thinking about the things that we think about nowadays. They were not able to model the storms the way we can do that now. We have a legacy system that has years of neglect. So there's rehabilitations that are needed in a lot of cases. There's inopportune design just by virtue of when the infrastructure was put in the ground and what the development around that infrastructure looks like at this point. And it really is better illustrated to see it on a map. So here, this is a prime example of what the development in Somerville looked like over the ages. This is a 1852 map depicting what was once the Miller's River. This is really important to understand because this was how the predominant area in Somerville drained out to the Charles River eventually. So this river network, as you can see near this Milk Street, this winds down and actually exits out to a bay that is now landfill that was basically closed in. As you can see here, this is all filled in basin. So at some point in the late 1800s, they decided that it was a great idea to develop by just offsetting that water storage. Now we know a lot about this. This is a horrible idea to develop land in this way because you've cut a ton of volumetric storage out of the capacity in the land. You've cut away a natural drainage path for stormwater, and you've made basically the situation that it needs to be managed through hard infrastructure, so pipes or some other intervention. So this is a good diagram to illustrate what the kind of current condition is. The water is channeled through a combined sewer and drain system for most of the city. So that means that every time you flush your toilet or it rains, it's getting into the same system. This system ends up discharging to the MWRA system, and that ends up at Deer Island being treated. So we're also considering the fact that we're taking stormwater and sending it down to a treatment plant, which is not opportune design. The other pathways that are present but may not be efficiently used is there is a secondary connection to the Boston Harbor that is actually for combined overflows, which are not a great thing. That means that sewage and stormwater is getting out to the waterways when there's a significant storm event, which is happening more and more frequently. And the other piece here that we'll be highlighting is there is railroad drainage that actually ends up to the Charles, which essentially replicates the existing channel from 1852, that Miller's River drainage basin. There's a closed pipe network that sort of replicates that pathway. It's really important to understand that as we describe the next situation. So we're going to get into the present now. So what are the things we're doing right at this time, and what is it about our system that we can actually intervene? So this is really mostly to show you that this is an area of Union Square near Somerville Ave. A lot of folks have heard about the Saucy project. That is it's a culvert project that is intended to accept flows that ultimately go into a combined system and allow us to separate some of that water, that storm water. So you'd have a sanitary sewer system and a stormwater system. They will connect to the same point at this time. So that all still goes to Deer Island, but separating those flows unlocks a lot of different potentiality. But the important thing to show here is that we have a restriction point in our system that is basically hemmed in by that hard infrastructure. So 60% of the drainage area in Somerville is going to this point. And obviously, when you think of it that way, it's really natural to see where you would have that restriction, where there's that increased storm event, you're going to hit that wall and get the floods. The system can't handle the volume of water. There's not really a pathway for it. The other thing to highlight here is that our endpoint for our system, where we have purview, connects to others. So we have a connection point to the MWRA system, where I mentioned Deer Island before. And that also takes in flows from Cambridge. So it's not just us. We have to negotiate a situation where there's existing flows in this pipe and we're adding to that. So what do we do about that? So Luchika, I'll hand over to you to talk about more of the strategy angle.
Yeah, so basically, right, the biggest practical limitation we face as a city is this physical capacity of the pipes that Jonathan was talking about, right? The physical capacity of the pipes we connect to. There's only so much water that can go into the system to alleviate some of the rain we see. And we're fortunate now that we have more sort of tools, strategies at our disposal to address it. That people didn't have 100 years ago, and one of them is the modeling. We have these hydraulic models that we can use to map our system and see how different rain events flow through, and also identify what the flooding and the weak spots in our system are. From then we could do a lot of planning, right? And we always try to look at our planning work in connection with other city departments and other city plans to make sure that the goals are similar. From there, we can start sort of putting boots to the ground, like we like to say, and do actual capital improvement projects. And you're going to see some examples of these projects in later slides. And these capital improvement projects, I think, are our biggest success story, where we know that just putting bigger pipes in the ground is not the answer. So we're looking at solutions that use green infrastructure alongside with gray infrastructure. Well, we realize that this is not sort of a winner takes all battle. We need both strategies to be effective in collecting all the rainwater. We're using green infrastructure at the top of the hill, to capture more stormwater up the hill that eventually won't go to the pipes that Jonathan showed at the bottom of the hill. So they can reduce the size of the gray infrastructure and the pipes that we'll need to put in. And they can help us deal with water quality. I know we talk about flooding, and climate change focuses on the water quantity piece of the stormwater, but the water quality is something that our stormwater management plan is always thinking of. Then we constantly think about operating and maintaining our system, right? We have a very old system. with a lot of legacy problems and neglect that we're trying to keep our pipes as clean as possible to keep their capacities. And then as a city, we have to put regulations and policies in place to basically have the teeth to do the work we want to do, and and even to make sure that we're achieving the goals we want to achieve. And this is sort of the toolbox we use. We try to keep the public engaged through all the projects we're doing and get feedback as much as we can. But in seeking solutions to these problems, like Jonathan said, it's important to acknowledge that there are constraints outside of our control than our city limits. Permit with MWRA that we have restricts how much we can use out of their system. The state and the federal government restrict the quantity and quality of the water we can discharge as well. And these are all important considerations we plan. So now in the next slide, I'm going to give you an example of a modeling project that is ongoing. It started last year and it's continuing through the 2021. It's a citywide drainage and water quality improvements plan. And this is aimed at a sewer shed level. And what I mean by sewer sheds is those sort of red polygons that you see in the image. The city was basically separated into 7 sewer sheds, and that's where each sewer shed has a discharge point where the water ends up going, whether it's the Mystic, the Alewife, or into the MWRA system. And at the end of this, and what this modeling and planning effort is hoping to achieve is come up with options, right, that will help us reduce our combined sewer overflows in the Alewife Brook and the Mystic River, mitigate localized flooding within each sewer shed, and evaluate water quality opportunities in each sewer shed by, incorporating green infrastructure. And I'll let Jonathan talk about some of the capital improvement projects happening in the city right now.
Yeah, thank you, Luchika. So I just want to go back to this slide to reset everyone. So this restriction is really key to a lot of the next steps we have to take. If we can't get over the hump on system capacity, there's not a lot we can do upstream, because when those bad flood events happen, the significant storms, everywhere is going to be bad. If we have a place to discharge to downstream in the system, you can do a lot more with that. So our intent in our near-term projects is to address that restriction. So some folks may have seen this map before. This is descriptive of a lot of the projects that are ongoing right now. So a significant one up the hill, as Luchika had previously mentioned, is the Spring Hill Sewer Separation Project, which is actually a multi-phase project that is incorporating streetscape improvements, water distribution systems, so the drinking water that your house gets, green storm infrastructure, as well as the pipe system that we need to actually manage the volume of water that can't be dealt with by green infrastructure. So it's really an all-phased approach, and that project particularly is fairly holistic. So that's to separate out that stormwater and give us the opportunity to manage it. And then the next link in the chain is the Somerville Ave Utility and Streetscape Improvement Project. Colloquially, we call it SASI. And that project is really a gateway. That is a large box culvert that gives us the opportunity to both store and pass quite a bit of stormwater. And that's really important because that allows us to get to the next phase of thought, is how do we manage the water now? So the project that will be upcoming that I'm actually the PM of is the Poplar Street Pump Station, which is allowing us to take advantage of a once in a generation, once in a 100-year type opportunity to actually harness the drainage on the MBTA's Green Line corridor. And why that's so important is because, as I had mentioned before, that actually drains to the historical flow path from that infilled Miller's River. So we're able to take a lot of that water that is impacting 60% of the city and finding a way to manage it back to its natural path, which is sort of a restoration to what the land did already. Land manages water quite well if you don't improve the land, but we've done that. There's impervious area throughout Somerville. There's not a lot of place to infiltrate. And this is allowing us to take advantage of some of those opportunities infrastructure-wise to manage that water. And, you know, on all of these projects, we're looking for opportunities to implement a full-phased approach. So Somerville Ave utility and streetscape improvement project, that includes some green stormwater infrastructure. You'll see, I think it's at the area near the old police station, there's actually some green stormwater features on the sidewalk area there. And then Poplar Street is definitely going to incorporate what we can fit at the site and then within the corridors themselves. And as I had mentioned, Spring Hill is definitely doing that as well.
Yeah, so we're spending a lot of effort in modeling and constructing these projects that are going to help alleviate flooding in the city. But we're also spending a lot of time doing what I like to call the less visible stormwater work, right? And I hinted to that earlier. We are doing a lot of operation and maintenance of our sewer and stormwater systems, because if they're not clean and if they're not functioning properly, if we have pipes that are broken, the system won't help us. So you see in this picture a vacuum truck cleaning a catch basin, so cleaning basically the sediment that deposits at the bottom of our catch basins. We're also doing a lot of reporting and complying work with water quality regulations that and permits that we have both from the state and the federal government. This is related to identifying illicit connections into the system and doing sampling of our stormwater. And also we're working hard on updating regulations and policies that will help us plan for the future. We passed a stormwater ordinance last year that gives us the teeth to implement a lot of this work and gives us the ability to come up with regulations and rules like the engineering site permit rules. That was last year as well, that kind of details and specifies everything that a resident or a developer on private property needs to do to manage stormwater, and looking at bigger storms and the idea of managing stormwater on that property so it doesn't get into the system is one of the bigger things we're looking at. And what's in store for the future? I think I can say with certainty that for me, the future looks like more regulation when it comes to water quality. We know that's coming from EPA and DEP, so we need to always think of how we're managing our stormwater, but also we know there's going to be more flooding, both due to precipitation and sea level and storm surge. We are fortunate that we live in an age where people are starting to think about regional solutions to these problems. And in this next slide, you will see some of the work that's been happening regionally. It's just an example. The Resilient Mystic Collaborative is a grassroots effort that was spearheaded by the Mystic River Association with the communities, the 21 communities in the watershed and the regulators, trying to look at this regional flooding problem and identify solutions, because there are communities that are affected by the sea level and storm surge flooding, but they can't find a solution on their sort of within their city limits. So that's the future. And this work includes the same tools and strategies that the city's using to manage stormwater, right? Modeling, planning, a lot of advocacy and policy regulation. And currently, there have been about 10 projects identified within the region that could alleviate some of the flooding you see in this slide. So I think there's a lot of hope for the future if we kind of all work together and try to figure this out. So I want to take this opportunity again to thank you. You can write down our contacts if you have further questions or you want to reach us separately. Happy to answer any questions.
Thank you. That was a great presentation. I know we have some questions coming in, so keep those coming. I'm actually wondering, Jonathan, would you be able to pull up that last regional flooding picture again? Because I want to just use it to answer this one question about what steps is the city taking to manage increased precipitation and coastal flooding, which I think, Luchika, you just covered really well, but I did just want to highlight that the situation in Somerville when we're looking at coastal flooding, so that would be like a coastal storm typically coming in from Boston Harbor and pushing storm surge up the Mystic River here and into the Charles. If you look at the areas that are colored in, this is like the areas that would flood in Somerville in those scenarios. They come in through Charlestown in Boston, through Cambridge, and as a result of the overtopping or breaching of the Amelia Earhart Dam. And so those are all things that the city of Somerville doesn't have control over, right? And so it's really critical that we're working at this at a regional level. And also just if you think about, how you go about your own life and, you're unlikely this year, maybe the exception, to spend all your days in Somerville, right? And so if there's a lot of flooding in Boston and Medford and Chelsea, that's going to impact what life is like in Somerville too. So it's really important to think about this as a regional scale. So that's part of why we're really focused on that regional partnership and finding solutions there. Okay, so I saw one question come in that was for Jeanette. So asking, you noted that there's a need for transformational change to address climate, health, and inequity. Do you have any thoughts on what some transformations would look like? That's a really big question, but maybe just a few examples.
Yeah, I've been spending the last couple of minutes trying to how do I succinctly respond to this question? I think transformation can happen at many different scales and in different ways. So there's definitely like the really large kind of capital projects that were just described that are happening in the city of Somerville that are proposed through the American Jobs Act that President Biden is proposing. There's also kind of a transformation of culture and expertise that is necessary. So one thing that I have been working a lot with is kind of trying to encourage partnerships between healthcare, health practitioners, and like climate practitioners, and then helping folks in the healthcare space understand that kind of these issues are relevant to their practice and that there are opportunities within healthcare to kind of start screening patients for potential climate-related vulnerabilities that they might experience. So, they have someone that has a kidney condition. It's important to ask that person what kind of housing situation they live in, whether they have access to an AC unit. Two things that I can think of is we need really deep transportations in both our food systems and our housing systems in order to address equity, climate, and health. So A gas stove is actually like a really huge polluter within a home. And so electrifying our housing stock will not only help us kind of achieve huge greenhouse gas reductions, but will also have a really huge impact on indoor air quality and health of folks. But we need to ensure that that is not only accessible to the people who can afford it, but is accessible to everybody, doesn't stimulate gentrification. So if a landlord does it in a development, that's not an excuse to raise the rent on folks. So it requires kind of this deeper commitment to then like making housing a right and ensuring that everyone has access to accessible, affordable housing that is secure, regardless of what kind of changes we're making to the house in order to achieve, better health and climate outcomes. I feel like that could be a whole presentation in itself, so I'll stop there.
Yeah, no, I think that's really great. And I will just add that I think, my perspective is how we tackle this is that just really acknowledging that so much is connected. So I think this year in particular was really eye-opening for a lot of folks of how connected our public health is to our economy, to structural racism, and how all those things intersect. And so I like to think that when working on climate change, we're always working on solutions that are also reducing inequities, right? And improving health for folks. So I think some more tangible examples are really around like healthy homes. So Jeanette was talking about stoves and electrification and indoor air quality improvements, but really important to think about, when we're thinking about energy efficiency projects, those were often set up to drive energy savings and cost savings, right? But there's so much else that can influence. And so really, I think expanding our thinking of everyone who kind of works in this field and related fields of how we can be solving these multiple problems at once. So again, we can talk way more about that, but I want to get to some of the other questions. Let's see. What is the status of the Nunziato stormwater storage project? I don't know if Luchika or Jonathan, if you have an answer to that one, or maybe just want to, if you do have anything to share on that, just also give an update on kind of what that project is for folks who might not be familiar.
Yeah, I'll take this one sort of. You'll have to bear with us because I think both of us joined the city after this project was shelved. I don't think there's any updates to share. I know that the project was basically designed, but the current status, I'm not particularly sure on. I think that's something that is definitely to follow up through like the general engineering at somervillemass.gov. And someone in the department is definitely going to have a better handle on that.
Great. And I think my understanding of that, I was here when that was still in the works, was really focused on alleviating some of the flooding and that constriction in the Union Square area. And I think that there's, with this Poplar Street pump station, there seems to be these other higher priority projects that kind of are tackling some of the similar issues, though we'll check with other folks in the engineering department to confirm. Okay, and then another question of, can we deconcrete the Alewife Brook? We have that as natural green infrastructure, but it's not as effective as stormwater retention if it's flowing over a hard surface. So this is a question I actually get often of, we're a really urban area. A lot of our rivers are not natural. I mean, we talked about the covering over of the Millers River. So what are the opportunities for that kind of going back to a more natural option?
That's a great question. I mean, the Alewife Brook spans what the city of Cambridge, Somerville, Medford. DCR is sort of the owner of the park around it. Not sure what the implications for permitting would be there, right? There are very strict rules that both EPA and DEP have to protect our waterways. But who knows what this regional work will end up being, right? This is, keep asking this question. I'll make sure to put it on my talking items for the regional work and meetings we have.
Great. And I think I'll just add that, you know, I think there's a lot that we can do with green infrastructure, but like Luchika was saying, you know, we really need to be thinking about this as like a both and situation of, you know, yes, green infrastructure is great. There are a lot of benefits that it can provide, but being a really dense urban area that has already had a lot of development that's, you know, likely not going to disappear overnight, right? That we need to kind of live with some of the legacy that we have. And so thinking about how do we build that great infrastructure and benefits of green infrastructure as well. So we have a few minutes left and I'm not seeing other questions. So if anyone wants to put another question in the chat or raise your hand, we can unmute you. You can ask a question with your voice. I will ask one question of our panelists while we wait for those last couple questions to come in, which is there, what's just one thing you would want Somerville residents to know about the work you do and maybe how they could either get involved or just, you know, a piece of information that is you think would be really helpful for everyone to know?
I think there's another good moment to plug the Keep Cool Somerville project. We have an idea workshop scheduled for next Tuesday, and that's inviting residents who would want to implement a project this summer to address heat impacts in Somerville, to come together and to share their ideas with each other, and to get support on developing that idea into a mini grant funded project. And like I was saying earlier, there's so much research that still needs to be done on the health impacts of climate change and on health interventions to address the health impacts of climate change, that this is kind of an exciting time for experimentation and testing. And like, we are genuinely interested in seeing like what individual residents propose, because that might be the best practice that, you know, we ultimately follow as a community. So you can be like a climate health pioneer. This is your opportunity. And I know that Hannah dropped a link in the chat.
Yeah, and I'll just plug that, you know, a great ambassadors project could be developing a pilot project proposal to submit for funding for this summer. So just encouraging that double dipping there. Luchika and Jonathan, do you have any final thoughts?
Yeah, something I would urge everyone to do is if you notice flooding issues, even just very small regional ones, we should know about those, because sometimes that's how we actually end up teeing up the next priority areas, is when we know about these things, and it does take eyes on it sometimes. And those can be flaws in the system we don't know about. It doesn't necessarily mean there's a specific vulnerability that's related to stormwater specifically. It could be that a catch basin needs to be cleaned out or a sewer manhole is compromised. Those are the things that we can actually execute quite well. So always keep it in mind that we're an email address away and people do read it and react to it.
Yeah, that's a good point.
And what is the email address? Could you put it?
engineering@somervillemass.gov. I will put it in the chat.
Awesome, thank you.
And 311?
Yes, always use 311.
Yeah, and then you can even use the handy app and send in pictures and things like that, so.
Yeah. And I think what I want people to know is that we're always thinking of how we can make the system work better and how can we prepare for the future. And I think what I urge all the residents to think of is these are really, really interesting and hard problems to solve, right? And I think what residents can do is keep being engaged, keep asking us questions, keep pushing us to do better and more. I think that that's going to help us get there.
Great, and I will just plug the Summer Voice page, which has a number of those active engineering and capital projects on it. So ways to engage, updates about meetings and things like that. I think there's one for the Poplar Street station, correct? And then the Spring Hill stormwater and sewer separation project. So those are two ways that you can get involved with active projects. And I can share those links around with the ambassadors too. So lots of ways to stay engaged. So we are at the hour. So I want to thank all of our panelists. We'll give you a Zoom round of applause. So thank you so much for joining, and really appreciate the presentations. And for the ambassadors, if you have further questions, please save them for our next meeting or send me an email and we can make sure to get answers to those in the next couple of weeks. So thanks again all for joining. Take care.
Thank you.
Bye.
Thank you.